Hi, my name is Michelle Embleton, and in this video I want to talk about what is double donor IVF. When is this treatment recommended? And want to take you through how the process works step by step. We're going to have a look at what are the success rates of double donor IVF and also how much can the process cost. We'll then finish by having a look at a couple of the most frequently asked questions from our users and answer them for you. IVF with donor sperm and donor eggs is an assisted reproduction technique in which both the man and the woman give up the idea of passing the genetic load of their gametes onto their children. The donation of gametes is legal in most countries, and each individual country, or perhaps state if you are in the US, have their own laws governing this. In many countries, the donation of eggs and sperm is an anonymous and altruistic process, and you cannot choose your donor. In the United States, you may be able to choose your donor. The general rules do require that donors are in very good health and are young, usually between 21 and 30 years of age. They have to undergo a series of special requirements, have good psychological and physical health. They need to have a karyotype test and check there are no genetic diseases in their medical history. There is also the requirement generally that the donor must not have any more than 6 children born from their eggs or sperm. In an anonymous donation, it is the clinic themselves that will choose the egg and the sperm donor based on certain characteristics of the recipient couple, such as what they look like and immunological factors such as blood groups. Egg and sperm donors will be financially compensated for their inconvenience, which will increase the cost of the treatment. Indeed, if you have a known egg or sperm donor, you may have to pay more for the particular egg or sperm you are using if you are in the United States, for example. IVF with both donated sperm and donated eggs is recommended when there are infertility or sterility issues on both the male and female sides. For example, if a woman has a low ovarian reserve, she may need to use donor eggs. If the man has a low sperm count or indeed a 0 sperm count in azoospermia, he may need to look at using a sperm donor in order to provide the male gamete. Women looking to become single mothers without a male partner will be requiring a sperm donor. And if during their fertility studies it is shown that they have some problems with their own eggs, they may need to look at having an egg donation treatment as well. The same applies for women in same-sex female relationships. They will be using a sperm donor to start with, but then if it turns out that neither of the women can use their own eggs for the IVF process, they may need to use donor eggs and donor sperm. In any case, when you are in consultation with your fertility specialist, they will always look for the best solution for the people who want to become parents. A double donor IVF treatment is basically the same as a conventional IVF treatment. However, it involves 2 more people, being the sperm donor and the egg donor. The first step is the selection of the donor. If you are using an anonymous donor, the clinic themselves will select the donors for you. Male donors have to undergo a physical examination, a karyotype to check that their chromosomes do not have any alterations, a semen analysis to make sure their sperm is of good quality, and a psychological assessment. Female donors will have to undergo similar testing with an ultrasound, karyotype testing, psychological testing. For both male and female donors, they will undergo tests to make sure they do not have any infectious diseases or genetic diseases to make sure that the process is safe. The clinics themselves will do a phenotypical matching, and this will look at things such as skin tone, eye color, hair color, height, to make sure that the babies have a good phenotypical match, that they will look like their parents. Genetic matching is also something that can be carried out, but is not standard practice in all clinics. And in genetic matching, the DNA itself will be tested to make sure there is no possibility of genetically inherited diseases. Once the egg donor has been selected, she will need to undergo ovarian stimulation for approximately 2 weeks. This hormonal medication encourages the eggs within the ovaries to develop. When enough development has occurred of the eggs, which will be monitored during ultrasound, an ovum pickup, also called a follicular puncture or an egg retrieval, will be programmed. This is an outpatient surgical procedure and is usually performed under a mild anesthetic or perhaps sedation. The liquid will be aspirated from the ovaries, and the eggs within this liquid will then be selected in the laboratory for the fertilization procedure. After the egg donor has undergone the egg retrieval process, the process is finished for her. She may receive financial compensation for her inconveniences and possibly require a checkup or two afterwards just to ensure that she is fully recovered from the process. The recipient woman does need to have her endometrium prepared in order to plan for the embryo transfer. The endometrium is the lining of the uterus, and it needs to become the correct thickness in order for an embryo to implant and grow within the uterus. So the recipient woman will undergo hormonal preparation with estrogens and progesterone to develop and prepare her endometrial lining. When we have the donor eggs ready in the laboratory, we need to undergo the fertilization procedure. Donor sperm will be used for the fertilization procedure, and in this case the donor sperm will come from previously frozen sperm samples. The first step for the sperm sample is to be thawed, and then it will undergo a semen analysis to make sure that the sperm are healthy, have survived the thawing, and that everything is okay for them to use. They will be prepared and capacitated, and then the fertilization step can be performed. This could be by classical IVF, whereby a drop of the sperm, prepared sperm, is added to the eggs and fertilization allowed to occur naturally. Alternatively, if the ICSI, intracytoplasmic sperm injection, technique is to be used, the specialists themselves will select one of the sperm into a microinjection needle and inject it directly into the egg cell in order to perform fertilization. Any fertilized embryos will then be cultured, allowed to develop for a few days in the laboratory and closely monitored. When the embryos are ready to be transferred, the embryo transfer will be programmed and the embryo is transferred into the previously prepared receptive uterus of the recipient woman. If any pre-implantation genetic diagnosis is to be performed, a biopsy will be taken before the embryo transfer and the embryos will be vitrified to be transferred into the uterus at a later date. The best quality embryos will be selected for the embryo transfer, and usually 1 or 2 embryos transferred into the recipient woman's uterus. Any remaining embryos can be frozen for future use. After the embryo transfer, the final step is the 2-week wait or the beta wait, which must be respected before you can take the pregnancy test to find out if the treatment has been successful. Since IVF with donated sperm and donated eggs requires 2 donors, there are 2 people who need to be compensated financially for their contribution. Therefore, the cost of this treatment does increase quite significantly, and it is one of the more expensive assisted reproduction treatments available. In the United States, a cycle of double donor IVF could cost between $14,000 and $20,000, but this figure is an orientative figure and will depend on clinic to clinic. In addition to these costs, the price of the hormonal medication must be taken into account, as it is not usually included in the cost of the IVF cycle. The recipient woman needs the hormonal medications to prepare her endometrium, and the donor woman needs to have hormonal medications to prepare and to develop multiple oocytes. Hormonal medication can cost an additional $3,000 to $5,000. Now I want to have a look at a couple of the most frequently asked questions that our users have and answer them for you. Double donor IVF using both donor sperm and donor eggs is one of the most expensive assisted reproduction treatments available. An alternative to this procedure could be embryo adoption and embryo donation. In an IVF treatment, a couple will often have leftover embryos, which are generally frozen for later use. If the couple decide that they do not wish to use these embryos at a later date, they may donate them to other couples who are having problems getting pregnant. When using adopted embryos, the only treatment needed by the recipient woman is the preparation of her metrium in order to prepare it to receive these embryos. One thing to bear in mind in the processes of embryo adoption and embryo donation is that the embryos themselves come from a couple who have been having problems with fertility. This may influence the chances of success of the treatment. However, the price of embryo adoption is much lower than double donor IVF, and also these embryos have to be of a certain quality in order to be used for embryo donation. The age of the recipient woman, whether it be a double donor IVF or an egg donation IVF, does not have a great influence on the overall success rate of the treatment. This is because the main factor is the age of the donor woman and the quality of the eggs. However, after the age of 45, it may be that the uterus is not in such an ideal condition for pregnancy, and this can have an effect on the success of the treatment. We want to hear about your experiences, so please do leave us a comment below. And if you've enjoyed the video and found it informative, don't forget to click like and subscribe so you don't miss any future videos. And as always, I would like to remind you that in the description below, I leave you with a link for an article where you can read much more about double donation IVF. And within this article, there are further articles for you to read all about the different IVF procedures.